Welcome to the American Society of Plastic Surgeons Roundtable panel discussion. I'm Caitlin Clark, and I'm joined by three renowned plastic surgeons and ASPS members. Dr. Aviva Preminger, a New York City board-certified plastic surgeon who focuses on cosmetic and reconstructive surgery of the face, breast, and body, and holds faculty positions at both Columbia and Cornell universities. Dr. Paige Myers, a board-certified plastic surgeon who specializes in all forms of breast reconstruction and serves as a faculty member at the University of Michigan School of Medicine. And Dr. Ash Patel, a board-certified plastic and reconstructive surgeon at Duke University Medical Center. And we're all here today to discuss the differences between plastic surgeons and cosmetic surgeons. Dr. Myers, let's start off with a very basic question. There seems to be an incredible amount of confusion about the terms plastic surgeons and cosmetic surgeons. Why do you think that is?
So I think that's a really great question. There is a lot of overlap between plastic surgery and cosmetic surgery. Plastic surgeons, though, have a much broader focus than simply cosmetic surgery. Plastic surgery is a lot of reconstructive surgery. We do head to toe reconstruction, whether that is head and neck cancer, hand surgery, all these different kinds of things. Cosmetic surgery does capture some of the aesthetic surgery, but plastic surgeons are really board certified in plastic surgery, which is a very rigorous training process.
Mm-hmm. And in your experience, have you had to educate prospective patients on the differences between the two? Have you, personally noticed that there's a lot of confusion surrounding the two?
Certainly for some of the more aesthetic procedures that we do, I often point out that, there's a lot of different ways to be considered a cosmetic surgeon, but plastic surgery and aesthetic surgery is really focused on that training and very, like I said, rigorous board certification.
Mm-hmm. And would you talk a little bit about the training that you endured to become a board-certified plastic surgeon?
Sure. There's a few different avenues you can get to become a board-certified plastic surgeon. Aspiring plastic surgeons could do 5 years of general surgery, followed by a 2 to 3 year fellowship in plastic surgery. Currently, there are integrated plastic surgery programs, which range from anywhere to 6 or 8 years of residency training. And then on top of that training, there are certain fellowships that people can specialize in to get a little bit of extra training in their expertise.
And Dr. Preminger, what training is required for plastic surgeons?
So for plastic surgery, we can do a combination of general surgery. I think it's very important because plastic surgeons work from head to toe. And so we really know how to function both in the face and the body. And as was described, it used to be that plastic surgeons did general surgery first and then did a separate plastic surgery specialty fellowship. I think now what happens more so is that the thought process is that the whole experience should be integrated. And from day one, plastic surgeons are kind of focused not only on regular surgical training and taking care of patients, but also specifically focusing on a mindset of plastic and reconstructive training.
So Dr. Preminger, about how many years does training encompass in its totality?
To become a plastic surgeon, the average plastic surgeon is looking at 4 years of college, 4 years of medical school, and then about 6 years of general surgery and plastic surgery training at a minimum, and then potentially specialization in a fellowship.
Wow. And do the majority of board-certified plastic surgeons do a fellowship?
I think it varies. I'm not sure what the exact numbers are. Mm-hmm. Certainly, if you're going to go into something like microsurgery or craniofacial surgery, it's pretty common, if not necessary, to actually do a fellowship. I think for cosmetic surgery purposes, people are a little less likely to pursue a specific fellowship in that. But I think the good news about all of this is, from a patient safety perspective, is that your average plastic surgeon is spending quite a lot of years training to get to do what they do on you safely.
Right. And so, Dr. Myers, what does board certification mean?
That's a really great question. So the American Board of Plastic Surgery is the main board certification process in the United States. Once you've completed your training, there are both a written component, a written exam, and then an oral exam, where your entire first year of cases at least is examined to make sure that you're a competent and a safe surgeon. So once you pass both the written and the oral examination components, you're able to be considered a board certified plastic surgeon.
And are there different levels of certification?
You can get different board certifications in different subspecialties within plastic surgery. So, for instance, if you then did a hand surgery fellowship, you could be both board certified in plastic surgery as well as hand surgery. And certainly the alternative training path to become a plastic surgeon can involve board certification in general surgery as well.
Would you say that a majority of plastic surgeons hold dual certifications, or is it mostly just one?
That's a really great question. I think historically, as the path to plastic surgery traditionally was through general surgery, I feel like maybe some of the more senior plastic surgeons hold both. I think most of us now that have gone through the integrated programs, and that's the kind of 6 to 8 years of intensive plastic surgery training from day one, are simply boarded in plastic surgery or one of those subspecialties.
Got it. And Dr. Preminger, can you be board certified in another specialty and call yourself a cosmetic surgeon?
Unfortunately, the answer to that question is yes. And I think that what is really surprising for people to hear is that you don't even have to be board certified in a surgical specialty to call yourself a cosmetic surgeon. So there are people who say that they're doing cosmetic surgery and they specialize in cosmetic surgery, and they've never actually done a cosmetic surgery or any surgical training at all.
Wow. And how does that happen?
That's a good question, actually. And I think that has to do with our government and regulatory agencies. And I think one of the things that the American Society of Plastic Surgeons has done to try to empower patients is provide information and educate patients and make them understand that cosmetic surgery is a big umbrella term that may not actually mean very much from a training and a certification perspective.
And have you needed to spend a majority of your time in consults kind of educating your prospective patients on the differences?
Thankfully, I think once the patients kind of come in to see me in the office, a lot of them have done their homework and understand. But I think sometimes when I'm at social events, I'm at school events for my kids, community events, there's a lot of confusion out there about what it means to actually be a plastic surgeon. And I think that it's really important that patients understand the difference between a board certified plastic surgeon and something like a cosmetic surgeon.
And Dr. Patel, it seems, with that in mind, it seems incredibly important to always visit a board certified plastic surgeon for even a non-surgical procedure. Would you agree?
Yeah, I do. And I think that it boils down to the length of training, the expertise that people who are board certified plastic surgeons have, and the process to become board certified, because that's really all about patient safety. So one way patients can do that is by seeing someone who is a ASPS member surgeon, because then they know that person's going to have been board certified in plastic surgery.
Right. And is there continuing education that's required by all board certified plastic surgeons to maintain their certification?
Yeah, absolutely. So anyone who's board certified by the American Board of Plastic Surgery has to maintain that certification with ongoing professional education. Some of that which is provided by an organization like the American Society of Plastic Surgeons.
Oh, wonderful. And Dr. Myers, what are a few ways that a patient can determine whether their prospective surgeon is a board certified plastic surgeon or a cosmetic surgeon?
I think the most important thing you can do as a patient is ask. The patient-physician communication relationship is always very, very important. So if you have any questions at all, just simply ask your plastic surgeon. The advertising or the website or whatever means that you go to find your plastic surgeon, board-certified plastic surgeons are appropriately designated by the American Board of Plastic Surgery through the American Board of Plastic Surgery logo. So they will have that on their website, they'll have it on their business card, as this is clearly past the rigorous training and board certification to be able to advertise as such.
Got it. And Dr. Patel, what is a red flag of someone who is not a board certified plastic surgeon?
Sure. So one way of identifying that is if you're on their website or social media profiles, do they actually say what they're board certified in? If it doesn't say what board they're certified by, then you really need to look into that and find out some more information.
And there are a variety of boards, correct?
Absolutely. There's a number of different boards, but the only board that certifies people in plastic surgery is the American Board of Plastic Surgery.
And Dr. Preminger, are there risks for patients who choose a cosmetic surgeon rather than a board-certified plastic surgeon?
I think there are tremendous risks to that. I think that anytime you choose to go to someone who is lacking in experience, lacking in training, and lacking in knowledge, you are basically taking your own life into your own hands. And I think especially when it comes to something like surgery, I think that it's so important that whoever you're going to is properly trained and knows how to manage issues and identify them if they were to arise. And so I think that if you're trying to cut corners and trying to save a few dollars here or there, I think what you really need to think about is this something that I want to take a chance with when we're talking about my health and my safety and my life, especially if it's something like a surgical procedure. And I always say to patients when they tell me before a surgical procedure that they're a little bit nervous, I tell them that makes me feel good. And the reason it makes me feel good is I want them to understand that plastic surgery, while it's become so commonplace, is not the same thing as getting a haircut.
Right.
And you'd be pretty upset if you went to a hairdresser that didn't do your hair the way you wanted it. But now we're talking about something far more serious. We're talking about your health, and we're talking about a real procedure, and we're talking about your safety. And so I always say to patients, I'm happy when you're nervous a little bit, because that means that you're taking this seriously and you understand and you've been informed of potential risks, et cetera. And so I think that when somebody decides to take risks and to go to someone who's not properly trained, I think it's really concerning. It makes me as a surgeon and as a human being really concerned for their safety.
Well, and I think one of the other things, sorry, I think one of the other things to consider is that plastic surgeons can offer more than just non-invasive treatments. So we can offer the patient a lot of different options based on what's right for them, which may be non-invasive, but may also be surgical if that's the right option.
And do you discuss all of these different options with the patient to determine which is most appropriate for them?
Yeah, absolutely. And I think it's really about offering the patient the right options to fit their goals.
I think that's so important, and you put that so well, because when a patient comes to me, and I do a lot of cosmetic procedures, what I say to them is, let's talk about these things from a spectrum perspective. So we're going to go from least invasive to most invasive, and the good thing is that you're in a plastic surgeon's office, so I can talk to you about all of it. I'm not just going to offer you the one thing that I can do, and we're going to find the procedure that best meets your needs. Sometimes you have somebody who comes in and says, I'm absolutely terrified of surgery, or I'm absolutely terrified of needles, or I can't tolerate any downtime. It really is a discussion and a back and forth about what is the best match for that patient in terms of their expectations and in terms of what we can achieve with a minimally invasive or non-invasive procedure versus what we can achieve with a surgical procedure.
One of the most alarming things I heard during the pandemic was the idea of this drive-through Botox, because it made me think that there was an absence of a crash cart just in case, a nerve or a vessel was hit. How important is that to have, even for non-invasive procedures?
I think it depends on the procedure. To be honest with you, Botox is a pretty low risk procedure. There's very little that can go wrong with something like Botox. I do think that when we start to talk about fillers, there are potential complications that can happen, and that's why you want to be going to someone who is aware of the potential things that could go wrong and is equipped to manage them if they do.
And Dr. Myers, in your opinion, with the prevalence of social media being used in a wide range of medical professionals and posting their before and after photos, do you think that's helping or hurting patients' education?
I think it's definitely a double-edged sword. My patients are much more informed than they ever have been due to the presence of social media, which information generally is a good thing. But there does have to be some significant vetting of what's out there, making sure that the information that they're getting is accurate, that those before and after photos aren't altered at all, and that they're really getting what we can really provide for them as plastic surgeons.
You're nodding. Do you have something to add?
Yeah, so I've actually done research on some of the topics related to what information is available on social media to patients, and the worrying thing is that most of that information is not really produced by people who have training and background in these procedures. So I think patients have to be very careful about the source of the information that they're learning from, and make sure that if they are looking at information about certain procedures, that they're looking at content that's produced by someone who's a board-certified plastic surgeon.
And would you say it's also important to not only investigate the before and the immediate after, but also, after 3 months, after 6 months, after a year, because everyone, tends to look good on a table?
Yeah, absolutely. And one of the things about these photographs is, as plastic surgeons, we try and make sure that the photographs are as standardized as possible, so you can get a true comparison, and not taken in a way that could be deceptive. That we can see that a lot now on social media, where patients sometimes have pictures with different lighting or in a different setting, or they're positioned in a different way. So that can dramatically alter what might be perceived as the result of surgery.
And even that very important standardization of photographs is part of our training. So in the board certification process, in your residencies, you learn the standardized kind of positions as well as the lighting to make sure that these photos are the most accurate and the most representative of the work that we can do.
That's so important to really be able to authenticate the before and the after photos as well. Because I wonder if patients are also coming away with a false sense of safety, because it is becoming so prevalent on TikTok and Instagram that they feel like it's so commonplace. You likened it to a haircut, that there is maybe this false sense of safety. Do you find that to be true?
Yeah, there is kind of this minimization of the, I don't like to say severity, but just, it's still an operation. There's still risks associated with it. And I don't ever want to minimize that by people bringing in these other, social media sources where it's a little bit lighter than what it actually could be. And I tell my patients that, every operation is the most important thing for me and you this day. And so making sure that that's the priority, I think, is really what I try to convey to everyone I talk to.
And have you found that to be true in your research as well?
Yeah, absolutely. One of the challenges is finding information that's balanced. We want to make sure that not only is there content talking specifically about the benefits of the procedure, but patients really need to know about what the potential risks are as well.
Are there any do's that you think patients should look for when they are, doing their homework on social media?
I think one of the big do's is to try and find someone who, if they're an ASPS member surgeon, that they're going to be board certified in plastic surgery. That they're going to follow certain principles to make sure that they're not misrepresenting results, and they're usually going to make sure that the content that they have on social media or on their websites is going to reflect both the risks and the benefits and the potential risks of any procedure.
And how about a red flag or a definite don't?
Oh, a red flag or a definite don't is if the pictures look like they may have been manipulated or photoshopped, if they're not comparative in the same lighting or patient position. Certainly, if they don't say whether the physician is board certified or what they're board certified in, those are definite concerns that I would have.
Yes. And how about you? What do you feel like are the top do's and don'ts for prospective patients when they're doing their homework?
So I think that, number one, when things look too good to be true, they probably are.
Right.
I think that, as Dr. Patel was saying, you really want to look at someone's training, their exact board certification, where they trained, potentially who they trained with, and then I think I always tell patients that they want to talk to the surgeon about how many of these procedures do you do. Talk to their own physician who may have referred them, a friend or a relative who may have referred them to that plastic surgeon. I think it's valuable to go to someone based on an actual referral rather than just something you may have seen on social media, which is really important. And then I also tell patients always that finding a plastic surgeon is also a little bit like dating. And you want to actually find someone who makes you feel comfortable. so there are a lot of different plastic surgeons who are well trained, who can accomplish the task and get it done. But you also need to think about the whole pre-op process and the whole post-op recovery. And there is a bit of hand-holding involved. And so you want to feel safe with that surgeon. You don't want someone who's going to come in, spend 2 minutes with you, feel like your questions haven't been answered, and that you're not going to be able to reach someone in their office afterwards when you have some concern.
Right.
And so I think that it has to feel right.
Yeah, I think you can't really overstate how the comfort factor plays into, your entire experience. Because if you don't feel comfortable, that just negates it right out of the gate, right?
And I think that has to do with, from the moment you walk in the door, how the staff is with you. I think it's a really important part of the whole experience.
Yeah, and are there specific things that you do to try to encourage, a strong comfort level within your patients?
Try to listen. I think that's probably the most important thing.
Yeah.
I really try to listen.
Yeah.
I think surgeons in general are not known to be the most patient human beings, but I really do try to spend the time listening so that I hear what the patient's expectations are, and I can try to understand that, and I can make sure that I'm actually able to meet those expectations or ideally exceed them.
How about you?
Yeah, I totally agree with what Dr. Preminger said, and I also like to think that anyone who comes to see me, they're not a patient, they're a person. They've got some unique things that they may be going through or challenges they may be facing, and I think it's really important for me to learn a little bit about them so that we can make sure that we tailor a care to what's ideally suited for them in their situation.
Right, definitely not a one-size-fits-all kind of thing when it comes to surgery.
Absolutely.
I mean, even when I have a new mom who comes in, not so new, but for like a mommy makeover, and they've got a 2-year-old at home, they're going to want to know, well, when can I pick my child up after surgery? Who's going to be giving them a bath? Who's lifting them out of the crib? What kind of help do I need? And I think that's so important in the whole recovery process.
Yeah, it's a very human experience, and these are real day-to-day questions and experiences that they're going to have and they need to plan for, right?
I think that open line of communication is just so important and can't be understated. I think really listening to your patients, speaking with them, having that open, very, very free dialogue about what your limitations are, what your expectations can be, what your goals are, is just the really best way to help people get the outcome that they're looking for.
Do you find that that's part of your training as well, kind of being half therapist, half plastic surgeon?
Yeah, absolutely. A majority of my practice is breast cancer reconstruction. And so just taking into consideration all that these women are going through. And I think that's one of the reasons why I really got into this to begin with, because these women, have their cancer diagnosis, but they're also moms. They're also, wives and teachers and partners, and just having this whole other thing that they have to deal with, I think is a really fulfilling part of what we do.
Yeah, well, that's a great way to close. Thank you so much for your time, surgeons. I appreciate it.
Thank you.
Thank you.